Okay, we are officially recording. Good morning. My name is Heather Miller, and I'm here today talk to Dr. Daniel Mick a little bit about research compliance. So first of all, could you go ahead and please introduce yourself and your role that you have at Heritage and the types of classes you teach?
Yeah, so my name is Daniel Mick, and I am an RN, and I have a PhD in nursing as well. And here at Heritage University, in the nursing program, teach a lot of the transition courses, so foundational skills and knowledge for the students. And kind of in my role, a major class is Nursing 216, which is Thinking Like a Nurse. And that's a transition course between a lot of the foundational sciences into clinical judgment and holistic thinking in patient care. And students then go on into their junior and senior years of doing their focused patient populations and applying the skills that they've learned. And then I see them sometimes again in their very last term in their professional role development as I do mock interviews, vision and statements of philosophy and other skills to prepare them to actually go into the workforce.
Awesome. Such an important workforce, as we mentioned earlier right now too. So glad you're doing that. So when you are talking about research or the responsible conduct of research, or just the mentioning of what that may or may not mean or look like to your students, what does that look like? And how does that, there's so much information out there, especially in the nursing program with what's research, what's not, how to help people make decisions. What does that look like for you when you're teaching or your students?
Yeah, so our nursing program, is actually quite unique, even nationally, maybe even totally unique, in that we do fundamental patterns of knowing. This is a theory promoted by Dr. Chin, and there's different realms of knowledge that we have in nursing. So there's empiric knowing, ethical knowing, personal knowing, aesthetic knowing, and all of those are emancipatory knowing. And unlike a lot of other programs, including my own when I was an undergraduate, we start our program with those. And so students come in with the foundational values and knowledge to apply during their program. And one of those classes is empirics. And so as sophomores, we have students doing what in many other programs is a senior level course as far as understanding how research works, in order that they're able to access research throughout their program and be able to analyze and evaluate whether it is applicable, look at that in a larger picture of the literature and such. And so students get that knowledge in their first term in the nursing program, and that's referenced by faculty then throughout the program. And so it is a little abstract at the beginning since they haven't dug into a lot of literature yet, but we constantly refer back to those concepts. And a lot of that is the ethical component as well, because we have the holistic consideration within patient care, not only as an individual, but also as a family and a community in the nursing program.
And that's so important. So it basically they're able to become consumers of the research early on, even though it takes years to be an expert, right? Like arguably we could pick up a paper right now after having and you're like, oh, I'm not sure what this part means, but the constant looking at the literature and the thinking about the research, that's amazing.
Yes, and that's something that is emphasized as well, that students need to know how to constantly access the literature and in order to apply evidence-based practice, both in the clinical setting and in their own research and academic considerations.
And you mentioned something else. You talked about, and I think that this is also unique to Heritage, about the local community and about what it means to be a nurse with the community, not just the individual patient, but the whole family. I see in my very limited purview of talking to Heritage faculty and administrators that this is really a key difference in Heritage versus other institutions and how they approach any academic setting, is that the look at the community. So can you talk a little bit more about when you're teaching your students about that community approach and how that's defined and what that looks like?
Yeah, absolutely. And that's imbued into the mission and vision not only at the university, but within our program, specifically within nursing. And we teach the content structured intentionally around that. The students learn first about the individual, and then the individual within the family, and then the individual and family within the community. And so they're holistic thinkers. And so there's considerations of a patient beyond just their physical needs and even just their psychosocial emotional needs. It's everything that's, financial and spiritual, and what are the barriers for someone to access care, much less able to implement it. Or in medicine, there's an idea of compliance. So we can't ask someone to be compliant to a health regimen or even a prevention regimen if we don't understand the context that they're living in. And we have a very unique community here in the Valley. I think that we're very fortunate to have the majority of our students who are in the nursing program come from the Valley, many born and raised, and they want to stay here because they have a connection to the community. They understand the community, they are part of it, and they're not only better able to address the needs of the community,
Absolutely.
but are personally invested in the community.
That's so important. So when you think about in the nursing field and protecting human subjects in research, and this might be beyond the scope of whether some of the things that you may or may not talk about in class, but even to you as a faculty member, what does that mean to you, protecting human subjects in research?
Yeah, then that's something that is applicable all the time. Our students are directly involved in research, particularly in their junior and senior years. But just because of where we are in the Valley, we're not a teaching health organization. And so there aren't patients that are constantly coming through that are parts of research programs. But there is plenty of research going on within the heritage community. And hopefully soon, as we stabilize the nursing department as far as the number of faculty and their availability, we can continue to expand our research endeavors. There's been multiple threads that have kind of started and stopped just because of the access of resources and time. But
time is the real resource for all of us.
Yeah. But for protecting human subjects in research in healthcare, there are obviously the very specific needs of the vulnerable populations. And the uniqueness of human subject protection in healthcare is that, same with thinking holistically about patients in the community, anyone across the lifespan is a possible research subject for healthcare. And that consideration is on both sides. So it's not only if you think about a population that is either geriatric or pediatric, but you have the healthcare providers themselves, the healthcare educators. And so anyone, anywhere in the chain can be involved in research. So there's a lot of very careful consideration about protecting everyone that's involved. I think a very important component of that, besides just being vulnerable populations, is the vulnerability of the relationship.
Absolutely.
And not that other fields don't have the issue of impressions of coercion or relationship of expertise or power, but within healthcare, there's implicit trust from the community and healthcare providers. And so consent and understanding of involvement in protocols and outcomes and such is very important to clarify in detail, to really understand, to assess understanding, to actually implement things like teach back and clarification, so that patients and families understand very clearly what's involved, because there can be a lot of misunderstanding or misinformation or expectation about what involvement in healthcare research involves, because a lot of people will consider it to be curative. They themselves maybe don't understand the research process and could get frustrated or misled by their expectations of what involvement in research means in the context of healthcare.
Excellent. Well, thank you. I every point that you bring resonates, especially when it comes to research of the importance of understanding it, how to support people and understanding their choices through research is something that we'll continue to work on as a whole community, right? As everybody. And
Yes.
I really appreciate your time. And I'm just going to stop now. Thank you again.